Breath holding spells. It is a reflex event which is initiated by anger and frustration or pain, and in this the child cries, and the crying stops by full expiration. There is apnea, cyanotic paleness, and unconsciousness. There is prolonged. In case of prolonged, there is tonic-clonic movements. Age, it is rare below 6 months and peaks in 2 years, and it is not present above 5 years. Differential diagnosis being seizures, cardiac arrhythmia, and there is long QT syndrome. And in case of management, there is parental reassurance and by turning sideways, avoiding undue concern,